David Smith is recognized as a national leader in the areas of treatment of addictive disease and psychopharmacology of drugs. New research strategies in the management and drug abuse problems and proper prescribing practices for physicians. He is the founder of 8 Ashbury free clinics in San Francisco, which merged with Walden House in 2011 to form Health Right 360, serving patients throughout California now. Dr. Smith has also served as adjunct professor at the University of California, San Francisco, and medical director of the California State Department of Alcohol and Drug Programs. He is a fellow and past president of the American Society of Addiction Medicine and of the California Society of Addiction Medicine. He is the recipient of 2013 Peter Haas Public Service Award from the University of California, Berkeley. And numerous additional awards and honors. Dr. Smith is founding editor of the Journal of Psychoactive Drugs and authored and co-authored over 350 journals, articles, and 26 books, including Unchain Your Brain, Clinician's Guide to Substance Abuse, and Guide to Psychoactive Drugs. Let's welcome Dr. Smith.
Thank you, Pornoy, for that kind introduction, and I appreciate your support of our organization. We happened to meet at the fundraiser for HR 360, which was tie-dye. Everybody's dressed in tie-dye in San Francisco celebrating the Summer of Love, so this is a very different audience today. I was asked to talk about an integrated approach to addiction treatment in a primary care setting. I am a physician that practices addiction medicine. This morning I saw 3 young heroin addicts at North Bay Recovery. We're in the midst of an opiate epidemic in the United States. 1 person dies every 4 minutes from a drug overdose. Can you hear me?
Yep.
Okay. I don't project as well. Can you hear me in the back? Sir, can you hear me? Okay. What it demonstrates, and coming down to this august campus, I'm a UC Berkeley graduate, and most of the time when I came down here was when Stanford beat us at football. But this is a very big and complicated campus. I arrived on campus at 3. It took me 2 hours to find the site back here. What it demonstrates is the broad-based interest in this area. So what I'm going to do is to take clinical issues, social policy issues, and integrate it into broad social trends and technological issues. The operating thesis is that social movements dictate technological changes, and technological changes impact on social movements. But in this area, the social movements began first. I mention that because addiction is our country's #1 public health problem. Like opiate addiction, cannabis dependence, cigarette addiction, alcoholism kills more, both in terms of primary deaths and secondary death, whether that's a contributing factor to diabetes, heart disease, and everything else, and basically all other diseases. And yet, it has only been recently that addiction has been integrated into the medical system. I mention that because in this august campus, they have developed this multi-million-dollar neuroscience institute. The focus has been on Alzheimer's, Parkinsonism, all these other brain diseases. At UCSF, they have a multi-million-dollar neuroscience. It focuses on the same disease, and yet the #1 brain disease in our society. is addiction. All the major movements exclude addiction, and in a certain sense just go after the respectable brain diseases. However, it's called derivative science. We, in the early days of addiction medicine, coming out of the university, looked at the scientific advances that occurred with Alzheimer's, Parkinsonism, other brain diseases, and then borrowed them to the modern practice of addiction medicine. That's what's happening. So if you talk about derivative science, it would be like you had an AIDS epidemic, killing a lot of people, a lot of misconception as to what caused it. We were some of the early parts of that because we were studying high-dose methamphetamine abusers in the gay population. The operating theory was that it was drugs that caused it. We had our epidemiologist that said, no, the spread is not like a drug. It's not going 1, 2, 3, 4. It's going 1, 2, 4, 8, 16. We were looking in the wrong direction. They looked in the right direction and found the virus. It took them 6 months to genotype the HIV virus. Just to try to demonstrate derivative science, raise your hands and try to get a little audience participation. How many of you have had a flu shot? Okay. You are the beneficiaries of derivative science. It took them 24 hours to genotype the recent strain of flu virus. And that technology developed from the HIV virus. That's derivative science. But what happened? You had a social movement act up that said there's discrimination against the gay population. You've got to do more research. And that's what drove the research that basically developed this. And now all of society is benefiting from it, including everybody in this room. So, this is one bit of support for my general thesis that social movements drive policy and technology advances, certainly in my area. In other words, if you start out studying a respectable disease, then society is right behind you. But if you start out studying a disrespected disease, then society fights you and technology fights you. But the scientific and medical community trained know that when you study the brain, you find basic advances that apply to all brain diseases. You also have a lot of far-out ideas out there. Steve Jobs' biography, he said, I got the idea for the iPhone by taking LSD. The phenomenon is called synesthesia, translation of one sensory modality to another. And he saw sound coming out of this object. A short distance from here, you've got the largest company in the world, and I see some people pounding away on their iPads there, not having the foggiest idea that it came out of an LSD trip. So that is social movement impacting on society and technology. Given that broad overview of the focus of my talk, the Haight-Ashbury Free Clinic began in June of 1967 during the Summer of Love. A lot of young people in this audience that weren't even around then. But what happened was there was hundreds of thousands of young people that flocked to the Haight-Ashbury. The philosophy of drug, sex, and rock and roll, and better living through chemistry. It was interesting because I just attended, I'm an adjunct professor at UCSF, and a noted psychiatrist studying the effects of marijuana and psychedelic drugs on the brain, and says, it's a lot more expensive to do that research in the United Kingdom because we have to feed our lab animals. Over here, all these young people use themselves as human guinea pigs. Nobody would allow what happened in the summer of love in any sort of humanism committee. Go to Golden Gate Park, smoke a large quantity of marijuana, take a whole bunch of mushrooms, take some LSD, and listen to Grateful Dead music and dance all night. So it was better living through chemistry, and it was the beginning of what we now know as the drug epidemic.
I was there.
Society did not like it. And of course, we're getting right here at home. Jerry Garcia was playing his guitar a short distance from here. Kim Kesey was taking LSD a short distance from here. And Jerry Garcia was the house band for the Grateful Dead. And you're right in the middle of the beginnings of that psychedelic culture in 1965. I came into the field at the end of the criminalization era. Why was it criminalized? In 1915, they ruled, for example, marijuana was a Schedule I drug. And in 1919, the Supreme Court ruled that physicians, even if well-intended, were subject to arrest. When I entered into the field, your sons and daughters that participated in that period were criminals, went to jail. And I, a physician, that left the lab where I was sticking LSD and white mice and then lived in Haight-Ashbury since 1960, took care of them. And I was aiding and abetting a felony. Except there was so many of them. How could you arrest 10,000 kids at one time? So there was a zone. A Stanford kid wants to come down to the Haight-Ashbury, listen to the Grateful Dead, and use drugs. They can't. Just don't leave the area. So we developed the beginnings of now the field of addiction medicine. As the drug scene changed, it moved into methamphetamine and then heroin, the first heroin epidemic. We were funded by rock and roll, Janis Joplin, Grateful Dead, Carlos Santana, Bill Graham and the Fillmore Opportunity. The free clinic movement in the modern era of addiction medicine was built on rock and roll. Interesting, they just got this great exhibit of Bill Graham and the Rock and Roll Revolution. It wasn't some government initiative. In fact, government brought us. But again, what happened was it was all in the rock and roll art that I'm going to elaborate on given the time. But there's this famous door. We have a conference June 10th. It's a David Smith conference on all of these issues with the UCSF. And there's me by this door. This door says no holding, no dealing, no pets. My granddaughter says, why no pets? You love pets, Grandpa. Any of these could close the clinic. Why do we do that? Because they sent undercover agents into our waiting. And then my picture was all over the DEA. We had DEA agents and folks across there taking my picture. But then they said, I don't know why you're doing this, but you're trying to help people and you're not selling drugs. So we had to put up that sign, that store, or that door. That was, so many recovering addicts, that's the first thing they saw was that door. In other words, they respected this counterculture. And law enforcement said, well, you're all out of UC. You know, I don't know why you're doing this, but you must be okay because you graduated from a state-supported university. I was wondering what would happen if I had gone to Stanford and graduated from a private university. They knew us, and they knew what we were trying to do. What happened? The Vietnam War. You remember that. All the troops went over there. Remember the first time I ever lectured at Stanford was during that era, 1968. They came back strung out on heroin. You can't put our troops in jail for getting strung out in a foreign and popular war. And therefore, what happened was they formed this initiative of which suddenly the government comes around and they want to give me money. And I said, yesterday you wanted to arrest me, today you want to give me money. I'm doing the same thing in the same place, but the world has changed. What does this say? Next takeaway point, It's not who has the disease, but how society views the population that has the disease. That is a very relevant point for the future teaching points that I'm going to make in my talk. Pardon me? I didn't want to do that. There we go. Got carried away. Okay. Founding philosophy of the Haight-Ashbury Clinic was healthcare is a right, not a privilege. That's on all of our signs. I got that statement by, they had organizing the Mississippi Freedom Riders in Haight-Ashbury, and they had to take down healthcare workers called Medical Committee for Human Rights. I'm a grandson of farm workers in Dust Bowl, California. I didn't know about segregated healthcare. Turned out, that's how I found out about it. And the beginnings of the free clinic movement and the addiction movement was a civil rights movement. Civil rights that you're discriminating against the population that you don't like. And it was derivative from learning the lessons of the Mississippi Freedom Riders in the South. Now, generalize. President Obama, in his health care reform message, says health care is a right, not a privilege. Bernie Sanders said health care is a right, not a privilege. They have no idea where that came from. In fact, I got a call, said, I heard you were the individual that came up with health care as a right, not a privilege in 1967. Says, I thought it was a Clinton speechwriter. No. Look at all of our literature, look at our signs, the beginnings of the National Free Clinic movement, health care is a right, not a privilege. Freud says, language and dreams are the road to the unconscious. If you come up with a term, then people have to either agree with it or disagree with it. That's what's happening in this current presidential election. You've got all the Republican candidates lined up against Obamacare, saying health care is not a right. And you've got all the Democratic candidates lined up saying that health care is a right, not a privilege. But when you create the term, they have to debate it. And that came out of that period. Again, ideas in social movements create a response from the system. It wasn't the system that came up with that concept, but it had to be successful. It had to be embodied and encoded into that system. And the first time I ever heard a politician say it was Teddy Kennedy in the 80s when he tried to get through health reform. Battled like crazy, didn't make it. But that's when it became part of the dynamic. Walden House began in 1969 when the addiction problem got much more severe. In other words, in the beginning we were managing the acute overdoses and then started realizing that this was a chronic disease. And management of the acute overdose, that would be like dealing with diabetic ketoacidosis in a diabetic patient. You can respond to the crisis, but unless you treat the underlying disease, you aren't going to get good long-term outcome. We lost so much musical talent there. Janis Joplin, Jimi Hendrix, and of course you just had Prince die. So, of an overdose. So that's when you saw the move towards long-term chronic disease management with Walden House, started by Dr. Walt Luttrell. So there was this interaction between Haight-Ashbury Clinic and Walden House. These two merged. The basic motivation for the merger was healthcare reform and parity. It was a result of some bad management issues. I left the Haight-Ashbury Clinic, as did Daryl Nava. Some businessman seized control of it, drove it into bankruptcy almost. Terrible, terrible thing happened. And then a heroin addict that we detoxed in 1968 referred to Walden House, achieved a recovery from Walden House, went to Harvard and got a doctorate. Her name is Vitka Eason. came back and said, Haight-Ashbury Clinic is where I started this. We need that medical arm. There's some bad management. I'm going to merge, save the whole thing. Now called Health Right 360, and it's taken over all the smaller clinics in the Bay Area. Because of healthcare reform and parity, you have to have electronic data records. And it turns out, and little techies in the office know so much better than I do. You create a system, there's a certain cost. And then to add 10 is another cost, but if every little clinic has to add that system, it's an impossible financial burden. So that has fueled this merger of the public health. And there are now multiple entry points. There's an integration of services with pharmacotherapy, models of treatment, psychosocial treatment. One of the things that we found out is 100% of addicts and alcoholics in our society will end up in the medical system. Variety of different ways. Trauma, overdose, diabetes, cannabis dependence in youth is being viewed as a pediatric disease because the peak incidence is at age 15. And yet the medical system has not been responsive to it. So the big push is to integrate addiction treatment into primary care. That is what healthcare reform is. It means that when you have this core benefit package, you have to look at addiction like you would cancer or diabetes. Now, that's the modern implementation of it. But one of the founding slogans of the Haight-Ashbury Clinic was that addiction is a disease and the addict has a right to treatment. And it's an integrated system. This is the scope of services for HR 360. We still do rock medicine, all the medical services of the rock concerts. But I'm going to generalize beyond the important part of the Healthcare Reform and Parity Act because it is being misrepresented. One of the most important parts of our attempt to deal with addiction in our society. During the criminalization period, that really peaked in the 80s, the war on drugs. The 70s was the time of government expansion of a health approach, in part because the Vietnam vets coming back. That's when they activated all the clinics like ours. But in the 80s, you saw the crack epidemic. And who did the crack epidemic impact the most? Lower socioeconomic, non-white individuals. That was the basis of the war on drugs. The basis of the war on drugs was aimed at poor people of color. You filled up the prisons. In the United States, you filled them up so much that the Constitution, that thing that some people forget still exists, declared a cruel and unusual punishment. So, now they're diverting all of them out of the criminal justice system into treatment. That's the biggest fuel of the expansion of healthcare reform. The biggest expansion of Health Right 360 is diversion to treatment from the criminal justice system. Now, I'm getting my sign here. I'm getting 3 minutes. In the Haight-Ashbury, we've never met a paranoid conspiracy that we didn't like. So, one of the theories, I'm not saying it's true, although the evidence just supports it. 90% of the increase in heroin addiction, prescription drug abuse, is amongst middle-class white people. In other words, this is not an inner-city epidemic. It is a middle-class white epidemic. One of the reasons, and it's clustered around the universities, schools where there's education, spread all over the United States, but it's clustered around there because middle-class people have health insurance, access to the doctor. They start out with potent prescription drugs. The physicians are untrained in this area. They give them all this OxyContin. They get addicted. dosage gets too high, and then move into heroin. Now that's a subset of the population. We're studying the genetics of that, but that's the population we see. Tamalpais high school student hurts his knee with soccer, goes to the doctor and gets OxyContin, falls in love with the opiates, steals his mother's opiates that has cancer or this, that, and the other thing, dosage gets too high, and gets into heroin. Now remember, these are social policy initiatives aimed at doing good. But many of us think that the heroin cartel understands these trends better than does the mainstream government. Because what did they do? They saw all these young people susceptible, and they flooded the area with heroin. There is massive quantities of heroin out there. You can buy lots of heroin within a walking distance of this campus. So, one of the conspiracy theories is that things didn't change until it hit the middle class. And now people are questioning the war on drugs. I'm not going to pursue that, but you're seeing some strange movements. For example, in Oakland with marijuana on the verge of being legalized, they've got this thing of reparations. They're going to give first permits to cannabis dependents because they see people of color are the ones that are the victims of this war on drugs. Now, the evidence supports that. If you're white and middle class, and you had a drug offense, or you were poor and black or poor and Hispanic, you had a 10 times higher probability of getting a felony if you're white and middle class. So the data clearly supports that you had a misapplication of this law. Now, from those of us that are in a health perspective, our position is if you have a disease and a disorder, it should be responded to in an equal basis. That healthcare is a right, not a privilege. That's my particular message. And you're going to deal with this with the current adult marijuana law. I've got 4 children, 3 grandchildren. I'm not happy about this modern world. I'm agnostic about whether marijuana should be legalized or not. However, from a healthcare point of view, the war on drugs, by every measure, is a total failure. It has been misapplied. It has been destructive. At Tamalpais High School, 90% of the high school students can get marijuana within an hour if they want. It has done nothing to restrict drugs. It has nothing but fill up the prisons. So the debate is, do we keep a failed social policy, or do we implement a new one? We have an issue of our journal of psychoactive drugs devoted to cannabis in California. I have references to that. The people that were in it were on the Blue Ribbon Commission that are part of the nuts and bolts of it. Our position was to have a health position. In other words, the world should not be just divided into pro-criminalization, reefer madness, pro-legalization, nobody is harmed. That's not true. A lot of young people that are having serious cannabis dependence problems. But our position is to have a health perspective. Some of those public policy issues are tax it and put the money into education and prevention and treatment. Because the most underfunded area in our society right now is adolescent treatment. There are many other health initiatives that we're battling to get in. But you're going to have a chance to study this initiative and apply it. Again, we have a whole issue of our journal about psychoactive drugs on it. And this would be an example of something that started. When I started, there were 10,000 young kids, young people smoking marijuana in the park. It was, you could get third-time possession, life imprisonment. Neil Cassidy of Ken Kesey's group got 5 years for possession of a single joint. Timothy Leary got 10 years. One of the things that they did was you can't arrest 10,000 kids. So we're going to have one high-profile bust. They busted the Grateful Dead in 1967. Fortunately, they forgot to get the marijuana, and it messed up their thing. It became the cause of celeb at the time. And one of the things that it did was made the Grateful Dead leave the Haight-Ashbury and help signal the downturn of the hate. So I think the final point is William Faulkner said, past history is not dead and buried, it's not even past. All of these items have direct relevance to what we're dealing with now. And now, I'm a member of this book club, and 3 of the seniors go down to the apothecarium and get their CBD for the chronic pain. In other words, it's mainstream. But that's the appropriate use. Whereas I also have a group of young people that are using 70 to 90% THC starting at age 15, becoming thoroughly psychotic and dependent. I think the final point there is that no drug has inherent moral characteristics. It's either used for good purpose or abused for negative purpose. And how you respond to that drug, I would hope, would be driven by science. My experience has been that it has been driven more by public perception as to who has the problem. And it brings out strange bedfellows. There's now merger and acquisition of large hedge funds that want to buy addiction treatment programs. So this old hippie doctor gets interviewed by Wall Street hedge funds. That's weird. Now pharmaceutical companies want to market us. They wouldn't have anything to do with us in the past. We did have some detail men that would drive up and open up their trunks and get all their samples out and we'd give them to the poor. But this world has changed dramatically. And I understand that you're all in the technology business and you're figuring out how you're going to respond to it and how you're going to deal with it. But I want to emphasize that the issues that you're dealing with, I hope you will be familiar with the social movements that we're behind it. So thank you very much.